Milwaukee County has seen a surge of confirmed COVID-19 cases. Let's get right to it. Joining us now is Dr. Jeff Potoff, UW Health's Chief Quality Officer. Doctor, thank you for being with us. A lot of people shaking their heads like, how does this happen? Milwaukee County has moved into the yellow category according to the CDC's new community guidelines. What does that mean for us?
Yeah, so these new guidelines that the CDC have had out for a couple months now really take into effect two factors. So one is the number of cases that are happening in a county, which is driving the yellow color right now for Milwaukee County. In addition to that, though, the healthcare resources available in that county. How many staffed hospital beds do you have? Is there availability? And that yellow color basically means that transmission is higher. There's more people in Milwaukee County right now walking around with COVID than there were just a couple of weeks ago. And that means if you're higher risk, so you're elderly, you're immunocompromised, you're unvaccinated, your chance of coming in contact with someone with COVID is higher, and you might want to mask up or, watch your distance.
Well, exactly. That was going to be my next question. So, of course, don't put the masks away. What about gatherings? A lot of graduations coming up, a lot of time, obviously, that we enter vacation time with the summer coming. Should we be leery? Can we safely gather with friends and family?
Well, I think unlike before, where we were relatively unprotected, we weren't vaccinated, we didn't understand these strains as much, we didn't have as much therapeutics. Nowadays we do have those things. So if you're vaccinated, you're boosted, you're not high risk. It's possible you may come down with symptoms, but it's unlikely that you would get very sick. And you would take then the desire to do the activity that you want to do, whether it's a graduation party, a vacation, with the risk that you might get a little bit sick. If I was at high risk, unvaccinated, or I had factors that would make me high risk, I might second guess that because I could be that person who gets pretty sick then if I get COVID-19.
Oh, that's good advice. The FDA has announced it is limiting the use of the Johnson & Johnson vaccine. Can you explain exactly what's going on with that?
Yeah, sure, no problem. So early on, weeks after the Johnson & Johnson vaccine came out, we knew that there was this slight risk, particularly in women, of developing blood clots. The risk was low, about the same as getting struck by lightning. But now, a year later or so, we have these other vaccines, Moderna and Pfizer, that don't have that risk. They're a little bit more effective against these variants that we're encountering right now. So the recommendation is, don't get the Johnson & Johnson vaccine if you can tolerate the other vaccines, Moderna or Pfizer. If for some reason you'd have an allergy or you can't get a Moderna or Pfizer vaccine, the Johnson & Johnson vaccine, by and large, is still very safe. It's better than nothing, but, will not see it used as much in the context of having these other vaccines available that are really effective.
Last question for those who can, for those who wish to do, when can we expect that fourth shot to come available to us?
Yeah, so right now, fourth shots are for those who are immunocompromised, have risk factors, or those who are over the age of 50. For the rest of us, I think that at a meeting that's going to happen with the CDC, FDA in June, we might see some more long-term guidance on vaccination strategy come out in July. And my gut tells me that that'll likely have a recommendation for boosters for the rest of us sometime late summer, early fall. I think that's probably the timeline that we're looking at.
Okay, great. That's a question a lot of people want to know. So Dr. Jeff Potoff, thank you for being with us again on this beautiful afternoon. See you soon.
Thank you.